And Dr. Haggerty, a question from you from one of our participants. How would implementation of the CTC program differ from a small city to a larger city?
That's a good question because most of the CTC communities that were in the test of the community youth development were kind of standalone communities ranging from about 50,000 down to about 5,000. So in larger cities, we work with mostly neighborhoods rather than the whole city. So maybe you'd look at a high school feeder neighborhood if you have neighborhood schools, or you might look at more defined neighborhoods within a city so that there's local control and decision-making at that more immediate level. So we really look to large cities to guide a process that's more neighborhood-driven or small community-focused driven rather than trying to do the whole city at a time.
Great, thank you. Jaclynn, we have a question that was submitted via Twitter. How do you get the attention of stakeholders to pay attention to this very important issue when there are so many other important issues at the city level?
I think that can start with just getting the attention of one influential person. It can be overwhelming to try to gather this whole group that you've written down on paper that are key leaders in your community. If you can gain the influence of one of these folks and get them educated in it and then have them start to be your spokesperson, it kind of plays back to that, the best advertising is word of mouth. But I find with that rapport that takes place, you're also helping to embellish that sense of community, that this is coming from different sectors, that there's a person that has influence over several areas in your community that finds importance in this and is willing to invest in it. And from there, you can kind of start to gain attention of the others. People tend to be very open to folks that are considered their colleagues.
Dr. Haggerty, another question for you. Do you know how effective CTC is in comparison to other substance abuse prevention programs? Is the intervention considered cost-effective?
Thanks. That's a great question. Remember, CTC is a framework. So it's a framework for installing other evidence-based programs. So you would expect that there's a potency to implementing other evidence-based programs like Life Skills, Lions Quest, some of those that Jaclynn talked about within the community. So you use that to organize data and make local decisions. And in terms of cost-benefit, we've done a cost-benefit analysis when we've compared communities that have CTC and those that don't, and have found that for every dollar spent, there's about $5.30 savings in reduced initiation of tobacco use and delinquency, just in those two areas. So it's a very conservative estimate of $5.30 for every dollar spent in communities that use communities that care.
Great, thank you. Jaclynn, another question for you. Since the implementation of CTC, has the data revealed new or evolving problems in the community? And if so, how are those addressed?
Well, one of the beauties of using these programs that I mentioned are so comprehensive, we are really being able to focus on several different risk factors so that we're able to avoid many problem behaviors. So we're seeing changes really across the data in a favorable trend, even though there are things that are going down that were outside of what our priority factors were. However, with that being said, we have seen some spikes in things. There was an increase in marijuana use between one of our surveys to the next time it was implemented. We've seen some concerns around prescription drug abuse. And then we've also had some students reporting that they're having some mental health needs, which obviously plays into substance use. So one of the ways to address some of these new issues as they come up, it helps in that process, that iterative process that we go through every 2 years, to be sure that we are still succeeding with the chosen interventions. And then from there, we start conversations specifically around these things that have peaked or become concerning. And by doing that, we are able to, hold mini trainings or awareness with the educators in the classroom. So perhaps during their drug and alcohol unit, they can emphasize a bit on marijuana, if that's what we're targeting at that time. And then we also are sure to make our police officers that teach a piece of our Lions Quest program aware of these trends or concerns as well, so that as they're giving information to our sixth graders, they're giving area-specific information so that we're sure to tackle those concerns right from the beginning.
Thank you. Ms. Wattenberg, a question for you. I'm concerned about prescription drug abuse. Can you talk about the scope of this problem in the United States?
Yes. the level at which overdose deaths have taken place due to prescription drug abuse and opioids in particular has been really huge. In 2009, more than 37,000 people died from drug overdoses. The majority of these were from prescription drugs, and prescription painkillers were involved in more than 15,000 deaths in 2009. The rise in these overdose deaths is what's really startling to people. It's been a fourfold increase since 1999, and it's interesting that you can't always make causal attributions, but this tracks with the increase in the sale of prescription painkillers, the opioid pain relievers. So the Obama administration, through the Office of National Drug Control Policy, has released a prescription drug abuse strategy, and HHS is helping to implement a large number of those action items, and you can find that strategy online at ONDCP. And this largely supports expansion of state prescription drug monitoring programs, take-back days where you can bring your unused medications for proper disposal. We find that a large number of the overdose deaths, or especially with youth, is that they're finding or getting the opioids from their medicine cabinets, which is why take-back is so important. And we're working on a number of different measures as well.
Thank you very much. Dr. Haggerty, another question for you. One of the participants states, we're looking to begin a new program in a location that we haven't worked in for alcohol prevention before. Do you have any suggestions of where we can look to receive baseline data on this community?
Right. So in the Communities That Care process, we actually use a school-based survey called the Communities That Care Survey. You can get that at communitiesthatcare.net. Where we survey 6th, 8th, 10th, and 12th graders that provides not only prevalence rates on alcohol use, but what are the underlying risk factors and protective factors that need to be targeted to get ahead of the problem. So we strongly recommend that people use a survey like that, we just think that having those underlying risk and protective factors is really helpful.
Great. Dr. Haggerty, another question coming in from Twitter. Have there been any attempts to better involve families into CTC?
Yeah, that's a great question, because I would say that in all of the CTC communities that I've worked in, they have some family programming going on. For example, Guiding Good Choices was one that Jaclynn mentioned as a program that goes on to complement the school-based programs. So typically, there's always family components involved, and parents and youth are active members of the Communities That Care coalitions.
Thank you. Well, another question that I'll direct to Ms. Wattenberg and Dr. Coe. What are effective interventions that target binge drinking and drinking on college campuses? I think you touched on that earlier.
Yeah, so there's a CDC community guide, and it pulls together evidence-based environmental interventions, and they include things that people don't normally think of, like dram shop liability laws, and those are laws that allow the owner or server in a retail establishment to be held legally responsible for harms that are inflicted by their customers that have been drinking too much. Zoning laws, like maintaining limits on hours and days of sale, are effective. Taxation, of course, of alcohol seems to be effective. Also, electronic screening and brief intervention to reduce excessive alcohol consumption is part of the community guide. And many of these interventions are made possible through the work of local community coalitions, very similar to what is being described today. And so I really encourage people to go to the CDC website and take a look at that community guide.
Thank you. Another question for either Dr. Haggerty or Ms. Sagers. Can you share the indicators you use to measure antisocial behaviors?
So,
Kevin, take that.
Yeah, Blair, you might help with this as well. Antisocial behaviors would be involvement in delinquent behavior, stealing things, skipping school. Blair, do you have those in front of you? I'm trying to think of them all off the top of my head. So actual behaviors that young people are involved in that are kind of pre-delinquent. So stealing something under $5 or something like that.
Right. Great. Thank you very much.